Hi, everybody. So I have been reading your discussion post this week, and this is exactly what I'm looking for. You guys did, really jumped into this topic. And part of why I like to do these ethical discussions is because everyone has something to say about it. So I really like that you guys took this first discussion board and really did some deep dives here on the research that's out there. So I just wanted to kind of throw my own 2 cents in on this and maybe play devil's advocate a little bit because I do enjoy that part of the discussions. So, I think we are all in agreement that obviously bullying is not a good thing. And one of the things that I think is the most important part of this in terms of how it impacts work, I mean, yes, it ultimately affects the nurse. But one of the things that in the bullet points here that we're looking at is bullying ultimately places patient safety at risk. And when I look at that, to me, I think back to my own experiences as a nurse, to where if you don't feel like you can ask for help because your environment is so hostile, absolutely, patient safety is definitely going to be at risk. But I want to kind of put this on the flip side, and this again is my own personal experience. So, and I think I told you guys last week, I've been an ER nurse for and trauma nurse for the duration of my experience. Now, there are some times where you will get an individual person who comes to work in your field who isn't very timid, sometimes what gets deemed as a know-it-all. And I have always said in my own personal experience that a person who doesn't ask questions, or a person who thinks that they know everything, that can be sometimes the most dangerous person that you work with. And I have been in situations where, my bosses have pulled me in to talk to me when I've been a preceptor and said, hey, the student nurse that we've assigned to you needs to be knocked down a few pegs. And you can kind of take that for what you will, but when you have someone who is so willful and so non-receptive to your teaching, how do you reach that person? I mean, I'm sure, and that's where I'm certainly not saying that bullying is okay, but I can tell you that there are circumstances in which sometimes the employers will let some of that slide because the person is so willful that they're not responding to any other forms of criticism. So I welcome you guys to give me your thoughts on that. What are your thoughts on that new nurse who is so difficult that the only way to reach them is through criticism or through sarcasm, and to kind of, as I said, knock them down a few pegs. So again, devil's advocate, it's not that I believe that that is the right way to do things, but I just want to kind of put a spin on it and see what you guys think. All right, I'll talk to you guys soon.